Good morning, everyone. It's good to see each one of you here this morning. This is meeting number 127 of the Standing Committee on Public Accounts for Tuesday, February 19th, 2019. And I would just like to, before we begin, welcome Rene Arsenault, Deputy, to our committee. He is replacing Remy, and we welcome you to this committee. I think also, before we begin, I would like to take just a minute to express our sympathies and respect to the Office of the Auditor General, again, on the passing of our Auditor General. This is the first meeting that we have convened since that. We've, in respect and going to the funeral, last week we did not meet. But I want to underscore again and I think Mr. Christofferson did it so well in his comments in the House, that this committee appreciated the extremely good working relationship we had with our Auditor General and with our friend Michael Ferguson. And to say the least, all of us recognize that we lost the people's auditor, as someone has said, and we've also lost a very honorable man. And before we go on and just move into the meeting, I think we'll just take a few moments of silence just in respect for him. Thank you. We're here today in consideration of Report 6, Community Supervision Correctional Services Canada, of the 2018 Fall Report of the Auditor General of Canada. I'll remind everyone that we are televised today, so if you could turn your phones to silent. Mine is in my jacket. I'll go to that as soon as we're into the meeting. We are honored to have with us from the Office of the Auditor General today, Mr. Andrew Hayes, Deputy Auditor General, and Nicholas Swales, Principal. And from Corrections Services Canada, Ms. Ann Kelly, our Commissioner, Larry Modiak, Assistant Commissioner, Policy, and Elaine Tousignan, Senior Deputy Commissioner. And so we welcome you all here this morning. We'll begin with Mr. Hayes, and the floor is yours, sir.
Mr. Chair, thank you for this opportunity to present the results of our report on community supervision. Joining me is Nicholas Swales, the principal responsible for the audit. Most offenders become eligible for release before their sentences end, serving a portion of their sentences under supervision in the community. As of April 2018, almost 40% of all federal offenders were supervised in the community. The number of offenders in the community increased substantially between 2013 and 2018, and Correctional Service Canada anticipates that this number will keep growing. This audit looked at Correctional Service Canada's supervision of offenders in the community and the agency's accommodation of them, when required, to support their return to society as law-abiding citizens. Cet audit est important pour une réinsertion sociale progressive.
This audit is important because offenders' gradual and supervised return to society leads to better public safety outcomes. Overall, we found that Correctional Service Canada had reached the limit on how many offenders it could accommodate in the community. We also found that it did not properly manage offenders under community supervision. In March 2018, nearly one-third of the federal offenders on release required supervised housing as a condition of their release. We found that Correctional Service Canada did not increase the number of housing spaces to keep pace with growing demand. As a result, offenders who were approved for release into the community in 2017-2018 had to had to wait on average twice as long for accommodation than did the offenders who were released into the community 4 years before. We also found that some offenders were not being placed in their requested communities because of capacity constraints. This made reintegration more difficult for those offenders. Furthermore, we found that Correctional Service Canada forecasted a need for more housing, but that it did not have a long-term plan to meet that need. This means that the housing shortages are likely to get worse. With respect to supervising offenders, we found that Correctional Service Canada did not provide parole officers with all the health information that they needed to design release plans for offenders.
Parole officers did not meet with offenders as often as they should have, and they did not always monitor special conditions imposed by the Parole Board of Canada as part of the terms of an offender's release. By not performing these activities, parole officers were not always able to conduct timely assessment of progress against the offender's release plan or to identify changes to the offender's needs or the risk that they present to society. Finally, we found that Correctional Service Canada did not properly measure its success in meeting its mandate to reintegrate offenders into society as law-abiding citizens. The agency measured only convictions that resulted in the return of federal offenders to federal custody. The agency did not include data on post-sentence offenses requiring the incarceration of offenders in provincial or territorial facilities. Without data on convictions recorded by other levels of government, the agency had an incomplete picture of the rate at which federal offenders were successfully reintegrating into society as law-abiding citizens. We made 5 recommendations, and Correctional Service Canada agreed with all of them. The agency has shared with us its action plan, which includes actions and timelines for our recommendations. Mr. Chair, this concludes my opening remarks. We would be pleased to answer any questions the committee may have. Thank you.
Thank you very much, Mr. Hayes. We'll now proceed to Commissioner Ms. Kelly.
Mr. Chair and honourable members of the committee, thank you for the opportunity to appear before you today to discuss the findings and recommendations of the Auditor General's performance audit on community supervision. Again, with me today are the Senior Deputy Commissioner, Mr. Alain Tousignan, the Assistant Commissioner of Policy, Mr. Larry Mochiak, and the Assistant Commissioner, Health Services, Ms. Jennifer Wheatley. While I have appeared before this committee as Interim Commissioner of the Correctional Service of Canada, I am honoured to appear before you today as the Commissioner, which became effective at the end of July 2018. J'aimerais prendre quelques instants.
I would like to take a moment to mark the recent passing of the Auditor General of Canada, Mr. Michael Ferguson. He was a highly respected public servant who dedicated his career to Canadians, and the impact of his passing is being felt by many.
The leadership of Mr. Ferguson have significantly contributed to our ongoing mission to assist offenders with their rehabilitation and to keep Canadians safe. And this fall 2018 report is no exception. This most recent report examined whether CSC adequately supervises offenders in the community and assists them with accommodation and healthcare-related services that facilitate and support the reintegration process. Comme le comité le sait, le service...
As the committee is aware, the CSC is responsible for offenders' sentences to 2 years or more, and it is important to note that the majority of offenders will be released back into Canadian communities. The service keeps Canadians safe through the effective rehabilitation and successful reintegration of offenders.
Parole officers and other institutional staff work closely with offenders to prepare them for their eventual release into the community. While incarcerated, offenders are encouraged to participate in various correctional interventions, such as educational and correctional programs and vocational training, in order to learn the skills necessary to help them return safely to the community and become law-abiding citizens. Il est important de noter que la
It is important to note that offender rehabilitation does not end once they are released into the community. Research demonstrates that society is best protected when offenders are gradually reintegrated into society through supervised release rather than being released at the end of their sentence with no controls or support.
release of offenders into the community under supervision allows them to be assessed, monitored, guided, and encouraged to become law-abiding citizens. Assisting offenders to become law-abiding citizens upon their release from prison is the most significant contribution CSC can make to keeping Canadian communities safe. With the appropriate level of structured supervision by their community parole officer, coupled with the assistance from their community case management team and members of the community, offenders can continue to apply the skills they have gained while in custody and benefit from new opportunities available to them in the community. Mr. Chair, CSC is experiencing a shift in how and where it is managing its offender population, with a greater proportion of federal offenders serving their sentence in the community. For example, CSC saw an increase of approximately 1,500 offenders managed in the community in the last 5 years, from approximately 7,600 at fiscal year end 2012-13 to over 9,100 in 2017-18. The community supervision population continues to grow. At the end of 2018, it exceeded 9,400. Moreover, both the numbers of Indigenous and women offenders on conditional release have increased substantially over the past 5 years, an increase of 36% for Indigenous offenders and of 50% for women offenders. In fact, there are now more women under community supervision than in federal custody. In addition, in 2017-18, we saw the highest number of day parole releases reported since 2012-13, an increase of 43%. As well, we saw the fewest number of revocation, a decrease of 27%. These results are positive for CSC. However, they also present a challenge, particularly with regard to community accommodation. There are approximately 200 community-based residential facilities in Canada, which are operated by CSC partners and accept offenders with residency conditions at their discretion. If one of these facilities is unable or unwilling to offer an offender residency, it is the responsibility of CSC to provide the offender with accommodation through one of its 14 community correctional centers. Our efforts to manage, monitor, and support offenders beyond institutional walls are as important as ever. Community supervision is critical to our ability to successfully reintegrate offenders into the community while ensuring the safety and security of all. Comme vous le savez, le vide.
As you are aware, the Auditor General made 5 recommendations to address identified issues around community supervision. CSC fully accepts the Auditor General's findings and recommendations. Work is already underway to implement measures to address these important findings.
Long-term approach to accommodations, we are creating a national long-term community accommodation plan. We have also begun developing a comprehensive solution to better manage bed inventory and match offenders to community facilities, including the management of wait lists. In terms of the Auditor General's recommendation regarding the monitoring of offenders, we have added a responsibility to the district directors to monitor on a monthly basis the compliance with the frequency of contact and the special conditions. In addition, CSC has reinforced the need for and monitoring of documentation to be completed in cases where exceptions are warranted to the frequency of contact requirements. En ce qui concerne la facilitation,
Regarding the facilitation of healthcare-related services, CSC is reviewing its policies related to the sharing of healthcare information and determining an approach that will be most effective in ensuring that parole officers receive the information they require in a timely manner. CSC also continues to work with provincial and territorial health authorities to remove barriers to accessing health care cards and to ensure that offenders obtain proper identification prior to their release.
Outcome data collection. CSC is collaborating with the Department of Public Safety on work in the area of recidivism rates, including information held by provinces and territories on adult reconvictions. The Auditor General's findings and recommendations have given us much to consider moving forward. Please rest assured that we are working diligently to address the audit recommendations. I will conclude my remarks by saying that I have been lucky over my 35 plus years with CSC to witness its evolution and its approach to corrections, as well as the considerable progress we have made in ensuring the effective rehabilitation and safe reintegration of offenders serving a federal sentence. CSC's contributions to creating safer communities would not be possible without the dedication and passion of the correctional service employees, our partners, stakeholders, and our volunteers. To all, thank you. With that, I thank you for the opportunity to meet today and welcome any questions you may have.
Thank you, Commissioner. With that, we will move into our first round of questioning. Our first round of questioning is a 7-minute round, and we'll begin with Mr. Area, please.
Thank you, Mr. Chair. Commissioner Kelly, welcome back. Commissioner, you did rightly point out that it is important to note that offender rehabilitation does not end once they are released into the community. You also said that assisting offenders to become law-abiding citizens upon their release from prison is the most important significant contribution CSC can make to keep Canadian communities safe. So, tell me in your words, that is the main objective, and Auditor General's report says that you have not met that objective. Why? You have been there for 35 years. You have seen how CSC has evolved. What are the things that were being done 10, 15, 20 years back, and what are the things that are being done now? So why is that it is still not satisfactory to the Auditor General?
Okay, first, 35 years ago, I started my career as a parole officer. I work both in the institutions and in the community, and I would say it was amongst one of the best jobs that I had. Certainly, as a community parole officer, frequency of contact, which is mentioned by the Auditor General, is one key element amongst many elements that comprise the community supervision framework. So frequency of contact is established when the offender is released into the community. It's based on the offender's risks and needs, and that's how you establish whether you're going to see the offender, let's say, 8 times a month, 4 times a month, twice a month, once a month, and sometimes when they've been in the community for a long time, it's more sporadic. What is happening with frequency of contact, and then there's other, I should say, there's other elements to the community supervision. So there's almost 3,000 offenders that are in the community that are residing in a community-based residential facility. When you reside in what we call a halfway house, you are seen by the people that work in the halfway house on a daily basis. The other things that are in place in the community as part of the community supervision framework, normally the offender has to report to the police, so they're seen by the police. We also have electronic monitoring in the community to assist in supervising the offenders. Offenders in the community are also expected to participate in community maintenance programs, which means they are seen by program officers. Many offenders also have as a special condition to see a psychologist, which means they are seen by a mental health professional. Many offenders also work, so they go to work. We also reach out to their family. In some cases, we do urinalysis testing with the offenders, and we do curfew checks. So as you can see, community supervision includes a lot of elements. With the frequency of contact, what has happened is when the Auditor General looked, frequency of contact is supposed to be documented in a certain place in a casework records. That's not always done. So I fully admit that we need to be better at documenting. The other thing is frequency of contact. The offender is continually assessed, so it can change. So although an offender, when they're released, may be seen by the parole officer 4 times a month, based on their progress, it may be reduced to twice a month. That needs to be clearly documented. Otherwise, the auditors are going to look for frequency of contacts and not 2. So that's something else we need to do. There are times where it's impossible for the parole officer to see an offender. And actually, the Auditor General has raised this, I know has talked to us about it. So for an example, a parole officer, there was a forest fire in their community and the parole officer couldn't speak to them. The parole officer in that case clearly documented that in the casework record, and the Auditor General's office actually accepted that. So these are the things that we need to do.
I know the time is getting short for me. I have a couple of other questions. You did mention the huge increase in number of people, in the last 5 years. How much it is from by 1,500. You are expecting now to be 9,400 people in this year. For community supervision population, have you had proportionate increase in number of parole officers?
In terms of parole officers, what we have in the community is a ratio. So it's 1 parole officer for 13 offenders. And right now, when we look at our number of parole officers and the ratio, we have 715 parole officers, and the ratio is around 1 to 13. It varies a little bit.
So you do have adequate number of parole officers?
Yes.
Okay. One of the things, obviously, to measure the success is that CSC is successful if the offenders return to society as law-abiding citizens. How are you measuring that? Obviously, the Auditor General has pointed out that you don't have data if they reoffend and go to the provincial jurisdiction. And you had mentioned that you are working with the Department of Public Safety on that. So what is the progress you have made on that?
Okay. So at this point, it's true. Once offenders have completed their sentence, we don't follow them up, but we are working with both public safety and StatScan to look at an automated way of capturing that data. And we do as well routine studies. So with the Social Data Linkage Project, that's with the Stat Canada, we hope to be able to cover both post-release employment and income, as well other health income, and also obviously readmissions to both province and territories. And I'll turn to my colleague, Mr. Mochiuk, because he had, sorry?
Quickly, because we're already over on time.
Yes, as Commissioner Kelly mentioned, we are engaging in joint projects with Stats Canada and Public Safety at looking at reconviction rates post-federal custody. And one of the difficulties is that having access into that data and routinely reporting requires some effort. So we're looking at automation and whatnot, and work is well underway on this.
And Ms. Kelly and Mr. Area. We'll now move to the second person on the first round. Mr. Kelly, please.
Thank you, and thank you, Commissioner Kelly. Can you? I noted in your opening remarks you spoke of the revocations being down, the number of day parole offenders are up, and revocations are down. Reporting that as good news. Yet, much of the report really talks about offenders not being adequately supervised during community sentence. So, how do we know that this is good news? If offenders are not monitored properly, which is what the Auditor General has said in this report, how can you assure Canadians that that they are safe when offenders are not being monitored adequately?
Okay, thank you for the question. First, I'd like to start by saying that we do have an increase in the number of offenders in the population, but we also have a corresponding decrease in the number of revocations, which speaks to the work that is done by parole officers. I think, as I explained previously, frequency of contact is one element of a broader community supervision framework. So I can assure Canadians that offenders are monitored in the community. What we did after the OAG looked at the cases, they looked at 50 cases. I asked my Mr. Mochiak, who's the Assistant Commissioner of Policy and has research under him, to also review the 50 cases and look at casework record and all documentation that were on the files of those 50 cases. What we found is in almost all cases, certainly the offenders are met within 24 hours of release. We also found that the compliance issues identified by the Auditor General, and they may want to speak to that, are not systemic in the sense that it's month over month that there's a lack of contact. In some cases, it may be one contact that's missed 1 month. In other cases, what we found is, again, some of the documentation, and this is something that we're addressing. Larry can speak, Mr. Mochiak can speak more to it, but in reviewing the case, there were lots of evidence that parole officers were very engaged with the offenders.
If I may,
Yes?
in page 9 of the report, for 19 of the 50 offender files examined, nearly 40%, we found that parole officers did not fully monitor offenders as required. Now, you've said that you accept the findings of the Auditor General, and yet I get a sense of defensiveness around this from you, Commissioner. Do you accept this finding that 40% are not being being monitored as required? Are there other requirements not correct? Should they be modified if all of these other various forms of monitoring that you've spoken of are sufficient? Why is the Auditor General saying that 40% in 40% of cases they're not being monitored as required?
Yes, and we accept and I don't certainly mean to be defensive, we accept the Auditor General's findings and recommendations. As I said before, in some cases, it's a question of documentation. In other cases, again, the frequency of contact, if they're changed during the month and it's not properly documented, unfortunately, the Auditor General will be looking for 4 contacts a month when actually there's 2 that are required. So as a result, what we're doing is we're amending our policy. We've added a responsibility to the district directors to monitor compliance with the frequency of contact.
It says that in 9 cases in which parole officers met with offenders on several occasions over a short period of time, which was not in keeping with the spirit of the policy. If I maybe perhaps I'll put the question to Mr. Hayes. Was it your? I thought that observation somewhat curious. It sounded like you were suggesting that officers may be, I don't know if gaming the system, so to speak, squeezing in several visits in a short period of time as an expedient rather than actually fulfilling the requirements. So is that sort of what you found, or?
Yes, so thank you. I guess I would point the committee to paragraph 646, where we mentioned that we found instances, and these are the 9 cases that we're talking about, in which parole officers met with offenders in a compressed amount of time, for example, 3 times in 6 days. The point that we want to make with this is that this approach did not allow parole officers to perform timely assessments of changes to the needs of the offenders or the risk that they present to society. The commissioner has mentioned that perhaps the requirements might change in terms of frequency of contact. And if they're not documented, the commissioner is correct that we would be looking for compliance with the policy or the requirements that were in place and documented at the time. I'll ask my colleague if he has anything to add to that.
I guess the only observation I would make is that we didn't attempt to understand the motivation for the parole officers in meeting with the offenders in a particular pattern. We just observed whether it was consistent with the intent of the policy.
Okay, then Commissioner Kelly, do you it's identified as a concern under 6.47 and under 646. Are you troubled by that finding, or do you find that there are explanations that are acceptable in this?
So again, for me, having worked in the community with offenders, if it's something that happens all the time, that every month the times that you meet with the inmates is you meet 3 times within 6 days, that would be concerning. It's if it's month over month. But in the community, there are instances where offenders may go through a crisis. And if they go through a crisis, you will find parole officers that may actually see the offender for 4 days in a row to help them get through the crisis. And then may not see them, may touch base through a call or a text message. So that does happen. And there are reasons why you would see sometimes that a parole officer has seen the offender more often. Yes.
Thank you, Mr. Kelly. And just before we go to Mr. Christofferson, I want to be clear on this as well. Are you saying that never would a parole officer want to have the check mark that he has met with them so many times, and so we can do this over the next few days? You're saying it wasn't the gaming, it might have been for very good reasons.
For very good reasons, yes.
All right. Thank you. Mr. Christofferson.
Thank you, Chair. Thank you, Mr. Hayes, Commissioner. Appreciate you all being here. As you probably know, back in another life, I was the Minister of Correctional Services in Ontario for a few years, which I have found is sometimes to the advantage of witnesses, in that I know what the challenges are in the real world, what you're facing, and other times it plays to your disadvantage because I can also see where the spin is in a way that I might not otherwise see. Just some thoughts before I go into detailed questions, Chair. Firstly, Commissioner, you clearly know your file and your 35 years show. But I got to tell you, I am not impressed with your written word. Your personal words are better, but you seem to have this, your communications people, I won't blame you, I'll let you off the hook and say your communications people, it's like the military. They do not seem to have the ability to say, we screwed up. We didn't do as good as we should have. We failed to achieve certain objectives. When the auditor report says that, it's not like it's a big secret. Acknowledge that. I got so furious the last 2 times we had the military. Clearly, blatantly, they screwed up. Do you think they would say so? And it made for a very uncomfortable hearing that didn't need to happen. So I say to you and the other communication departments that come before here, don't give us a lot of spin and tell us how wonderful you are. We know the good work you do. Acknowledge where you fell down and where you didn't meet the standards that are expected by virtue of the report. So I leave that with you. Also want to comment that on page 5 of your remarks, Commissioner, you said, in fact, there are now more women under community supervision, 51%, than in federal custody, 49%. I just want to say that with the exception of some cases, society's never really well served by locking women up, especially moms, especially in nonviolent cases. And I'm very glad to see that there's a move to recognize that if there has to be a sentence, that where possible, keep women and moms in the community. It just makes, I think, good sense for all of us. Yeah. Again, just in the opening remarks of the deputy, again, this is what we found just in the opening remarks in terms of the findings: did not properly manage, did not have a long-term plan, did not provide, did not meet, did not properly measure. I won't take the time, but I marked out the comments in terms of what was the focus of the audit and whether you passed or failed. Basically, you failed. On most of the areas, there were clear problems. So let me delve into a couple of things. First of all, on page 1 of the Auditor General report, it states that 40% of all federal offenders were supervised in the community, and yet only 6% of the budget goes to community corrections. So doesn't it make sense, even from an economic point of view, if not for a societal one, to be putting more money in there? I mean, 40% of the offenders, but they only get 6% of the budget.
Yes, that's true. It costs quite a bit less to keep offenders in the community than it is to keep them incarcerated.
Indeed it does. Which is why I found it perplexing on page 2 that it could take more than, paragraph 6.11, it could take more than 2 years from the time a site was selected with a community partner to the time the first offender was placed at a new facility. So I agree with you. One of the benefits to society with community corrections is that it costs us a lot less money, and hopefully we're achieving the same goal, as Mr. Arias said, which is to return people to society as law-abiding citizens. So, and I want to come back to that point specifically, because you knew the population was going to grow. You knew that. Your own reports had said it, but you didn't plan for any more facilities. Pourquoi?
Thank you for the question. So we're changing that. Actually, at both the local and regional level, there's a lot of work that was being done. Both myself and Mr. Touzian have been regional deputy commissioners, myself in the Pacific region, Mr. Touzian in Quebec. I can say that in the last 3 years, 200 beds have been added to the beds that we have. And this is in large part because of the work done at both the local and regional level. But I do agree, though, with the Auditor General that we need to have a line of sight on this at the national level.
Yeah, Commissioner, with respect, my question to you was, you had studies in front of you that you knew with certainty the populations were going to increase. We know that it's better for citizens that find themselves in conflict with the law, that community corrections is best. We also know that it's cheaper to do it that way. So my question is, in knowing that you were going to have increased demand, why did you not plan and ensure that you had the facilities that you knew you were going to need?
Again, at both the local and regional level, there was work being done. So for myself, and
so everything's fine, no problem.
Well, it's because they know their population. So, for example, in the Pacific region, there was a lot of work being done. We knew that we, for example, had a number of offenders with mental health issues. So we opened a halfway house called Mariakiri Cottage for those offenders. We had a number of offenders that were Aboriginal. So the district director was extremely involved in working with community partners to actually find available space. The same thing was happening in every region, and that's why actually it was also recognized by the Auditor General that there was an increase in the number of beds. However, what we're doing now is developing a comprehensive long-term accommodation plan, a national plan.
And my question was why you didn't do that before. Thanks, Chair.
Thank you, Mr. Christofferson. We'll now move to Mr. Sarai, please.
Thank you. I want to thank you. I actually have a lot of constituents who are correction officers and work in the force, and a lot of family and friends as well. And it's a very admirable career, and most of them have had very satisfactory lives and currently are employed with them. I also have a city which is has a lot of youth crime, so Surrey Centre and Surrey in general has been exposed to that. So concern about people reoffending is a high priority. One of the concerns I had was it appears that a significant portion of offenders did not meet parole officers enough. Was part of the problem the fact that there's simply a shortage of parole officers, or and was that prevalent in Pacific and specifically the Pacific region and in the West Coast?
Thank you for the question. I don't have the information in terms of where it was more prevalent. In terms of the frequency of contact, again, it's one element of a broader community supervision strategy. So I actually outlined some of the other things that occur when offenders are in the community. Certainly, if they reside in a community-based residential facility, they are seen by the staff from the facility on a daily basis. And there's curfew checks, and they also participate in employment and in programs, so are seen by program officers. For us, it's a question, what we're doing is ensuring that we're changing our policies to ensure that the district directors actually monitor the compliance with frequency of contact, and obviously ensuring that it's properly documented where it should be documented.
And would you be able to table to the committee based on region? I particularly would like to know on if there is a shortage of parole officers on the West Coast, particularly in the Greater Vancouver Lower Mainland region.
So based on just the numbers I have, on the West Coast, as I said, the ratio for parole officers 13 to offenders is 1 to 13, and actually in Pacific it's 1 to 11.
Okay, good. Secondly, in Surrey, there's a concern that some offenders are so dangerous, and this is more of a public safety concern for the officers or parole officers themselves, that they have no place to meet them because the offender himself or herself is at risk of being a target, and therefore they are not meeting the offenders as stated by their conditions. Is that a case? And if so, how do you mitigate that case or situation where somebody is on parole, or in a parole-like setting, however, they're at risk, their own lives are at risk, and therefore the Corrections Canada officer is not able to meet them, or meet them only in very, very secure areas such as a police station, etc. Are there ways to mitigate those?
Yes. So normally, in terms of frequency of contact, we try for a balance between home visit, where you can see where the offender is residing, but also visits in the office. We also have what we call a staff safety assessment template that has to be completed. And if there are concerns, the supervision can take place in tandem, which means it's not just one parole officer, but 2 parole officers that actually see the offender. In cases where there's concerns because of potentially, gang activities that's happening, you're quite right. The visit may also occur at the police station, but certainly not in the offender's home in those cases. It would be more in the office or elsewhere.
Now, you also stated that there are delays in being released to facilities due to offenders being rejected from. No, so what I want to know is, are people being delayed on getting parole or neighborhood facilities because the community-based organizations are rejecting them, and therefore there is a queue or a long delay in getting into one of the 14 correctional Canada-based facilities? Would that be the issue? Is there a shortage of correctional facilities managed by the by Corrections Canada? Is that the cause of those delays in getting out?
There are some different reasons. So you're quite right in terms of the CBRF that are operated by our partners. They have admission criteria, and in a lot of cases, for example, they may not accept sex offenders. In those cases where the CBRFs are not willing to accept the offender, then it's our responsibility, CSC, to accommodate them in one of our community correctional centers. So in the Pacific region, it's the Chilliwack Center, but also Belkin House in Vancouver is an enhanced CBRF. And yes, then we would accommodate them. Now, in terms of why they sometimes wait to be accommodated, there's a variety of reasons which we are now going to be tracking more closely. In some cases, the offender waits to complete the programs they've started in the institution. That may be one reason. Sometimes they'll wait for a specialized bed. There's also, in some cases, that they'll wait for their preferred location. Because I will admit that in some cases, we see it mostly in Toronto. We have two CCCs, one in Kiel and one in Toronto, one in Kingston. If the offender wants to go to Toronto, sometimes it's full, so they first go to Kingston, Ontario. So.
And my last question, and this is a concern for, I think, Canadians in general, but particularly my constituents. We're seeing a good pattern that people are getting placed into community-based facilities more prevalently. However, I just want to confirm that the reoffending rate has dropped as a result of that and not increased. There's a public perception always that we release people too early and therefore they're about to reoffend, but I'd like to get it on the record that the rate is actually dropped, if I'm correct. If you can elaborate on that.
So we, and certainly Larry can speak more to it, but we track certainly outcomes. So in terms of percentage of offenders not readmitted to federal custody within 5 years following the expiration of their sentence, we're actually at 85%. So it's been increasing the rate. So we are quite successful. The other thing is there's been a decrease in the number of revocations. So when offenders are returned to federal custody, which is also a testament to the work being done by those that work in the community. Larry, I don't know if you want to add anything.
Breaching any parole rules. Obviously, reoffending is a breach, but includes reoffending in any new case.
That's right. Revocations can, and we also split it out in terms of those that are coming back for technical violations of their conditions, as well as reoffense, and they're all on the decline.
Thank you.
Thank you. If you want part of this round, you have 2 minutes. Okay, or wait until the second round? All right. Thank you. Mr. Nuttall.
Thank you, Mr. Chair. Thank you to the department for coming, as well as the work done by the Auditor General's office. I have a pretty specific question, because one of the things that we're facing in our community, I know that this is an issue that's expanding across the country, and certainly isn't unique to Barrie, is as offenders are coming back into, or former offenders are coming back into the community, we've seen a heavy percentage of being targeted for drug use by drug dealers, etc. And there seems to be a lack of supports available between the emergence of the individual back into the community and specifically what we're seeing in the opioid crisis as a whole. Is there tracking done? I know they'd be tracking on drugs as a whole. Is there and the use and obviously the requirements under their emergence back into the community? Is there any information that would show the for lack of a better word the rate at which individuals are either using while they're in custody and then using in the community when they emerge back in?
Yes, so we do keep data in terms of in the community. So it's possible that offenders will incur charges for drug-related offenses. Definitely in terms of the opioid crisis, what's happening in the community at large, we see reflected in our institutions and in the community, which is a concern to us. We do offer programs to offenders. We also offer the opiate substitution therapy to offenders. And I'd certainly ask Ms. Wheatley to speak to that. In terms of the community, if an offender has difficulties with alcohol or drugs, normally a special condition is going to be imposed upon them by the Parole Board of Canada. That special condition has to be monitored. The other thing that we're doing is for offenders that are being released to the community, we now have an initiative called Take Home Naloxone Kit that they leave with. And we also, through the communicating with a health professional, they can be directed to where they can go if they require more. So maybe I'll let Jennifer speak to that.
But before we get there, I guess, and this was actually what I wanted to draw out, Mr. Chair, just to focus.
Yeah, I was just
directly
going to
back.
say, I'm not sure that she understood the question the way that you asked it.
Yeah, maybe I'll be more direct because I was trying to couch it a little bit to be fair. I have a real issue with, we say supervision, but and that's the language we're using, supervision of offenders emerging back into the community with drug use. And it amazes me, and I've been doing a lot of research on this, but it amazes me that we have people emerging back into the community as addicts still, which means that they've been using while in custody within our penal system. And so when it says access to health care, is there not a route directly for those individuals? Because the correlation between drug use and reoffending is very real. So is there not like a system in place to, make a mandatory, or at least do the best to make mandatory changes within those individuals' lives?
So maybe I'll try again, and I'll ask Ms. Wheatley. So definitely there are offenders that are released to the community that still have a drug abuse problem. In those cases, as I mentioned, normally there's a special condition that's imposed upon them by the Parole Board of Canada. We can also do random urinalysis in the community, or if we have reasons to suspect that they're using, we do urinalysis testing. If it tests positive, then we can take action against the offender. So the offender can be suspended or can be revoked and returned to federal custody, absolutely. So we do monitor that. Jennifer?
So problematic substance use is a very complex health need, and we're fully committed to implementing all pillars of the Canada Health Strategy, which includes the enforcement elements that Commissioner Kelly spoke about, harm reduction such as the take-home naloxone in treatment. whether an offender is currently using while they're incarcerated or not, they can still have a substance misuse problem. So sometimes using a substance is indicative of access to a substance. So you can have offenders who don't use while they're incarcerated and are still have a substance misuse problem on release. Substance misuse is very difficult to treat. I won't get into all the technicalities, but whether you're in a community treatment center for the average Canadian or whether you're in our services, there's very low success rates for substance misuse treatment, but we're certainly committed to doing our best. What we're doing to improve our approach, particularly in response to the opioid crisis, in addition to the take-home naloxone and the nursing teaching, is we're reviewing our entire opiate substitution therapy program to make sure that we have all of the supports, including the medical supports, the psychosocial supports, etc., so that we can have the best outcome possible for this very difficult disorder to treat. Okay, can I say
You
one
can
more
finish
thing?
your thought,
Okay.
yeah.
So, for example, we've seen a doubling of the number of offenders on opiate substitution therapy in recent years. It used to be 400, it's now 800. So we know that's a stabilizing factor, and offenders on opiate substitution will be more ready for release into the community.
Thank you very much. Monsieur Arsenault, vous avez 5 minutes.
Mr. Arsenault, you have 5 minutes. Thank you, Mr. Chairman, and thank you to all the witnesses for being here. I'm new here. This is the first meeting that I've attended, so I apologize in advance if my questions aren't always appropriate because I don't have the whole context. So I will start with Ms. Kelly and then a question from Mr. Hayes. The auditor found two problems, lack of accommodation, which seems to be a crying need, and then poor management of offenders who are being supervised in the community. In your opinion, when did you realize that there was going to be an increase, a sharp increase, in the number of offenders that were going to be released on parole because you needed to look ahead? The population in the community has been increasing over the past few years. When I look at where we were in, say, 2012-13, in the community, there were 33% of offenders. Now it's 40%. So there was an increase happening, but when did CSC realize that there was a need to address this problem? We did an internal assessment in January 2017. We looked not only at what was happening in the community, but also in our facilities and made projections. Then we started to look into the issue, and that is when the audit was just beginning. As I said earlier, we are doing a lot of work at the local and regional levels to increase the number of beds available in the community. And the auditors recognize that a lot of work is being done in the region. It's there that they know the offenders and know the needs and the number of beds available. We certainly agree with the Auditor General. We do need a national plan. We need to know at the national level what is going on and to see whether there are any barriers in the different regions that make it difficult to increase the number of beds. So this is something we need to look at in order to be able to help those regions. So that is the approach we're taking. Thank you, Mr. Arsenault. It's not just the number of beds, I would say, but also the type and location of these beds. We need to look at the number of the types of offenders and the types of beds. Sometimes there are enough beds, but sometimes we don't have the special needs addressed, and that's where the problem arises. That brings me to my next question. There's there are indications of lack of information, lack of supervision. Do you have a typical approach depending on the seriousness of the crimes committed and so on? When it comes to information, access to health, the criminal background, and so on. Yes, absolutely. We have what we call an offender management system, and that includes all the information. And so it's individualized, yes, for each offender. We have the background, the offenses committed, their associates, motivations, the potential for reintegration. Many types of information are included. I have a question now for Mr. Hayes. You said that it was clear that parole officers didn't meet with offenders with the frequency that they should have. Is this something you can compare to some standard? What do you mean that they didn't meet them as often as they should have? We looked at the files in depth in a certain number of cases, and we looked at what the expectation was for the frequency of contact. There are different levels of supervision that are required, and we tried to understand what level of supervision was expected for that particular offender. We looked at a 12-month period after release, and that's what we use as a basis for our calculations. Thank you.
Thank you. So this is a committee for accountability where we study reports from the Auditor General, and departments are asked to explain what has happened and in their departments. I want to draw to your attention under, I guess it's on page 13 of the report in English, measurement of results. The Auditor General found that performance measures did not include data on offenses requiring incarceration in provincial or territorial facilities. CSC officials informed us that such data on convictions was excluded because it was difficult to gather. The Auditor General, though, actually made the point of mentioning that this is public information. And we hear this, I'm relatively new to the committee compared to some of the others, but I've already seen this over and over again from a variety of different departments that have been before our committee on the poor collection of data, insufficient retention of data, in particular from when it's from public sources. I mean, how hard can it really be? So I would like an explanation for why something that would seem to me as obvious as tracking offenses that would have a person incarcerated back in a provincial facility, and why that is not tracked as part of the monitoring of results.
Okay, and again, I'll turn to Mr. Mochiuk because he actually tracks all of our data. But once offenders have completed their sentence, we didn't follow up in terms of, we only knew whether or not they had been in a provincial or territorial facility if they returned to custody. Otherwise, we didn't know whether they picked up a fine or had gone to the provincial institution. It's only when they returned to us. From time to time, we did studies, but now in working with Public Safety and Stats Canada, we're trying to find an automated solution so we can get access to that data.
That's excellent. I'm pleased that there are steps being taken.
Absolutely.
But from an accountability point of view, this seems like a pretty obvious thing. Why was this not done? We're well into the information age. Why are we right now talking about not having kept track of offenders that have gone not into the federal system but the provincial system?
Mr. Murray.
Well, of course, measuring recidivism. measuring recidivism is an important performance metric in any criminal justice system. And when they're under our federal supervision or under our jurisdiction, we know if they've come back, what kind of offenses they've committed out in the provinces and territories, because we systematically gather that at readmission. And also, while they're under federal supervision, if they're still under a kind of a warrant with us, we also know if they've committed a new crime in the community. The difficulty for us is that when they're finished their sentence with the federal system and go out into the community, of knowing whether or not they commit another crime without some effort. We would have to actually link into the Canadian Police Information Center system and make that match and that linkage. We know there are some technical, logical issues in doing so, but we are going to try to now find ways of doing that, of making a better automated linkage on a routine basis. This is information we've done in the past in studies. They've been very expensive because we have had to hand code them actually, and it takes a couple of years. But nevertheless, like you have pointed out, in this era of automation, we're looking for technology that will assist us to do this.
Is getting on this. What did they say when you pointed this out? I mean, were you the first person to suggest this was important information that they keep track of?
So we feel that it is important information. Without the information from territorial and provincial convictions, it's difficult to know whether for sure the rate of reconviction is indeed declining. Clearly, the commissioner has provided statistics on the rate of federal reconvictions, but we don't know overall without the information from the provinces and territories.
Thank you, Mr. Kelly. We'll now move to Ms. Yip and then to Mr. Christofferson.
Thank you for coming. This is in regards to recommendation number 1, identifying offender population profile characteristics that are critical to release planning and for the selection of accommodation options was to be completed last November 30th. Was that completed, and what was the outcome?
Sorry.
It's under the Management Response and Action Plan. And it says the Assistant Commissioner, Correctional Operations and Programs was responsible.
Which one? Oh, okay. It's this one.
Action plan or from the Auditor General's report?
From Correctional Service Action Plan to address the recommendation of the OAG. So it's from Correctional Service Canada.
So this is, I believe, whoops, if I look at it correctly, I have an update for that. This was what was to be completed by the 30th of November, 2018? Right. Okay. Yes. So, and this was to identify offender population profile characteristics that are critical to release planning. My understanding that has been completed. The initial list of characteristics critical to release planning established and will be used in conjunction with projected releases data. And additional characteristics may be added following consultation and depending on data availability. So that first part has been done.
Okay. What is being done to be proactive instead of reactive to take a long-term approach to address the housing shortage? Because I found that in your documents here, the greatest anticipated demand for housing in Ontario is at 32%.
Yes, so we're working on a national long-term accommodation plan, but in the meantime, we've actually had now many discussions with the regional deputy commissioners in each region to talk about this. I can tell you that from 2017-18 to November 30th, there were 61 beds added. By the end of this fiscal year, there's going to be another 77 beds that are added, and there's already 120 beds planned for 2019-20, as well as other potential bed availability. So, but at this point, what we're going to do is ensure that we collect all of the information from the regions, and as I said, have a comprehensive solution. Because it's, as Mr. Tousignan pointed out, it's not just the number of beds. If you look at the number of beds we have available and the number of offenders that require residency, we actually have enough beds. Now, the thing is, are they the right beds in the right place at the right time? Because we do have offenders that require specialized types of beds. We have Indigenous offenders that maybe follow a traditional path and are looking for specific beds. We have offenders with mental health issues that have to go to a treatment center. So this is what we want a line of sight on at the national level, and ensuring, as I said, that we have the right beds. In terms of bed availability, it's not an issue everywhere. So, for example, in the Atlantic region, it's not an issue. There's enough beds for the number of offenders that are in the community. In some pockets, though, like for example, in Ontario, especially in Toronto, that's more of an issue. And there's lots of work being done to look at increasing the bed capacity, potentially even looking at establishing another community correctional center in that area.
Okay,
And beyond what's been, so if I may add, beyond what's been done at the regional level, nationally, we've reached out to a working group. We now have a working group that comprises from CBRF owners and representatives from each regions across the country. So we met in Ottawa a few months ago, and now we've had discussions with them to try to be proactive and talking about the needs that we have from now and also in the future years. So that outreach is really helping us out in trying to reach the right beds.
And I have to say, it was a first meeting in several years with the CBRF's representatives, and they're actually very supportive of the work we're doing in terms of ensuring that we know the offender's preferred location, where they're actually going, and where the beds are in terms of bed inventory.
Thank you very much. We'll now move to Mr. Christopherson, please.
Thank you, Chair. First thing I want to say is, and I meant to say this in the first round, you mentioned that your background was a parole officer and a number of times the work that they do. I just want to say probation and parole officers are like the secret sauce that makes this work. They are amazing people who are so dedicated and so smart, and they get very little thanks. They get mostly aggravation. It's a tough job, but it makes such a big difference, and I could never say enough about the work that the probation and parole officers do, provincially and federally. I mean, they really are amazing people that could do so many other things because they've got so many skills, and yet they dedicate themselves to an area that can be heartbreaking. I mean, just making a determination of whether your client is mad, sad, or bad is a tough call, and then dealing with all of that. It's just that I just want to emphasize how blessed we are in Canada with professionals who dedicate themselves to probation and parole officer and the work that they do. It's amazing.
Thank you for that.
It was well deserved. I wanted to mention, just on a lighter note, when I can, that I want to share some of the, especially my Liberal colleagues from Ontario might know Steve Mahoney. Steve Mahoney was an MPP Liberal in Ontario, went on to become the president, CEO, or chair of the WSIB. One of the funniest parliamentarians I've ever served with. Him and Chris Stockwell just had me in stitches. Anyway, the day I walked into the House after I'd been appointed to cabinet, one of the pages brings me a note, and I open it up, and it's from Steve Mahoney, and it says, "Congratulations on your ascension to cabinet. You are now the landlord to a significant part of my family." I always thought that was cute. Okay. Now, on a very different note, I want to talk about health cards. And in my now 15 years on this committee, nothing makes me crazier than when I see there were previous recommendations made to departments or agencies and entities, and they don't do it. And then there's another audit and the same recommendation and the same promises, and then they don't do it. And on page 11, we have a similar problem. There was an internal audit regarding the health cards and the problems around that in 2012 that identified this. Your own CSC found the same issue, and the Correctional Investigator of Canada in 2014, which is now 5 years later. So please help me understand how you can have at least two, if not three, major audits that point out a problem that has to do with the health care of people returning to the community, and corrections failed to do anything about it on both counts, and here it is again in front of us. Please explain to me how we got here and what's going to be different this time.
Okay. Well, thank you, and thanks again for all the things you said about probation and parole officers. It's much appreciated. In terms of the ID in general, it's been an issue we've been tackling for a long time. The first thing that happens is once an offender is admitted to federal custody, a parole officer sits down with the offenders and ascertains what kind of cards they have, and if there are cards missing, assisting them in getting the cards that they require. We've reached out to the province and territories to ensure that a process is in place at remand centres to retain, track, store, and transfer the ID with the offender when they come to federal custody. There's even follow-up letters that have been written by the Assistant Commissioner to their counterpart to request ongoing assistance. As I said, once an offender is admitted to federal custody, a parole officer sits down with the offender and figures out, okay, what cards are you missing? In terms of the health card, Ms. Wheatley will be able to speak more to it, but certainly regional management is working with various stakeholders, including provincial health officials and Service Ontario, to reduce the barriers in accessing provincial cards, because as you know, in a lot of provinces, you can't apply for a health card until you are released. The other thing that I'm very excited about, and this is building on the success of the Prairie region, we now have a new partnership. It's going to be in the form of an MOU. We're just poised to sign it with Indigenous Services Canada, through which Indigenous Services Canada staff visit various sites and assist Indigenous offenders to apply for their status card.
I'm sorry to interrupt. It's very good stuff. I mean, I hear you. I see you reading your talking points. You still didn't explain to me, though, how your organization failed to respond in 2012 and in 2014 to exactly the same recommendation. And I have no doubt that somewhere in there you were giving the same talking points. The fact is it didn't get done. And I understand about the ones that are issued and you can't be issued until they're out. That's in here. Anybody can read that. You didn't tell me anything I didn't already know, Commissioner. I'm not impressed with that answer. And Chair, I've only got two more questions. On the action plan?
Please hurry, because you're a minute and a half over.
Well, I'll wait till the end if you wish,
Okay.
Chair.
Yeah, that might be best.
Sure.
And then we'll keep on track here. We'll now go to Mr. Arsenault again. Monsieur Arsenault.
How many minutes? Encore une fois.
So once again, I can't remember very much about this committee. I haven't been here for a long time, but Mr. Swales and Mr. Hayes.
2013 to 2017, 28, right? Am I correct? C'est l'espace de votre étude, ça?
Was that the period covered by your audit? Yes, from 2012-13 up to 2017. So 2012-13, 16, 17, we had this increase of 17%. Is that correct? And your comments indicate that your audit was partial because it only dealt with offenders that did not return to facilities. No, the cases that we included in our samples were individuals who were released during that period. So there is no link with whether or not they returned to institutions. Okay, I did not understand correctly the first time. When I read your remarks, I see that it says that the Correctional Service, we found that Correctional Service Canada had not properly looked at whether they could provide the supervision, and it was only federal inmates. So there was a lack of information because the provincial and territorial information was not included. Can you give me an idea of what is happening at the provincial and territorial level? No, we do not have information on the rates of recidivism in the provinces and territories. That said, in paragraph 75 of our report, we mention a study that was carried out by Public Security in 2003, which is quite a while ago, but it indicated that the recidivism rate was 85% if provincial and territorial incarceration were included, 25% rather. So we didn't include that in our report, in our calculations, but it was an observation. So 16, 17 years ago, it was 25%. And you're talking about the provinces and territories, yes. Ms. Kelly, I asked you a question, but perhaps I didn't express myself well. When Corrections Canada was getting prepared to address the increase, what I want to know is whether you saw that increase coming and how you prepared for it. The population in the community has been increasing for several years, since 2012, 2013. In 2012, 2013, 33% of offenders were in the community. Now we have 40% of them in the community. We undertook an in-depth internal analysis in 2016-17 to see how we needed to address that. We looked at how in the community, in some regions, there were problems because we didn't necessarily have the right number of beds. A lot of work was being done at the local and regional levels. Even the Auditor General recognized that there had been quite a number of beds increased. So we need now to get more information from the regions to have a national plan about the number and types of beds that are needed, the types of delinquents and their profiles, so that we have the right match. When you answered me earlier, you said...
Back and go to Mr. Kelly and then to Ms. Yip.
I want to again have you expand, Commissioner Kelly, on some of the answers you've given already on the number and availability of beds. I heard what you said, that You said that there's not an aggregate shortage, but there may at any given time be regional or specific shortages for specific needs or specific regions. And yet, page 6, 6.32, Corrections Services Canada did not maintain data on how many offenders were not placed in their requested communities, did not record the reasons offenders were not placed in their requested communities, did not maintain data on the types of specialized housing that offenders needed in the community-based residential facilities. Why?
Because we didn't have the information at that time. What we've done since is we've added structured, because we can request the information from the regions, but that's not good enough. We need to have structured fields, and that's what we've done in our OMS, an offender management system, so that we can have both the preferred location and where the offender is actually going. We're also going to be tracking wait lists and why offenders are not released. Yes.
I did ask why you wouldn't have kept, why didn't you keep track of that? And that isn't an answer to that question. But if there is no answer, then I'll perhaps move on. We talked about and Mr. Christopherson was talking about the already identified issue around health cards and the recommendations in the past. It occurred to me, to what extent is the health of an offender that is placed in community supervision, how is their health monitored? Are these folks in good health when they are released? Is that something that is monitored or tracked? Are the health needs of offenders known at the time they're released from a custodial facility? I can only, I'm sure that mental health, of course, is long connected with offenders, and we've talked about substance addiction problems, but is the health of an offender well known and documented?
So, again, Ms. Wheatley can expand, but yes, relevant health information is shared with the parole officers. As the Auditor General found, the information should be shared in a gist, and it's not always the case. That's on us. We need to fix that. But in many of the cases, when we reviewed them, the information was shared through the community strategy. So yes, in answer to your question, the health of the offender is known to the community. Jennifer?
So we provide essential health care to incarcerated individuals, just like provincial health care plans provide it to the rest of Canada. So on release, we prepare discharge planning that's relative to the health needs of the patient, because on release to the community, they become then included in the Canada Health Act, and the provinces become primarily responsible for their health care. Any risk-related or management information that needs to be shared with the parole officers to manage and supervise the offenders safely in the community is then shared prior to release from health to operations. And as the Commissioner mentioned, we're reviewing that process because we know the information is happening, but it's sometimes happening outside of the process. So we're reviewing the process to make sure the documentation is appropriate.
Ms. Yip and then Mr. Christopherson.
Going back to the housing pressures, especially in the large urban areas, how can CSE expect to accommodate these offenders trying to reintegrate into society when the regular population has such a problem with housing? And is that part of the community capacity analysis of the 2017 internal strategic review?
So you're quite right. In terms of the availability of housing, it's not everywhere. It's mostly in kind of metropolitan centers. So, for example, in Toronto, we have two community correctional centers in Ontario. One in Toronto, one in Kingston. They can both accommodate 40 offenders. Many offenders want to go to Toronto, so sometimes when they are full, they will have to go to the facility in Kingston until a bed becomes available. But in Toronto, there's discussions that are underway right now because I got an update with different partners and with the city to look at increasing the bed availability.
Okay. So there isn't any future plans to build more in terms of longer range anticipation of the growth that you've mentioned in your report?
Sometimes it's a mix. Sometimes it's adding to facilities we already have, so adding some beds. In certain cases, it could be actually potentially building, but then it's a fairly long process because there's many considerations that have to be taken into account. Obviously, the community also has to be consulted.
Well, given that, shouldn't there be more long-range planning thought out?
Absolutely. Absolutely. Because again, it's not just for CSC, it's not just a bed is a bed is a bed. Sometimes it's the fact that for some offenders, we require specialized beds. So we need to have the right mix in the right places.
I just make that comment because there seems to be a shortage, and then they're waiting, and also the low-risk offenders are waiting longer than the statutory released offenders. And so that's why I think that it's really important that there is a longer proactive plan.
Yeah, you're absolutely correct. And that's what we're working on. Because you're right, offenders that are being released on stat release have to be released by law. And if there's a residency condition imposed on their stat release, then we need to find them a place to reside. And they would be released before offenders that have been granted day parole if we don't have enough beds. So that's why for us it's imperative that we have a long-term, multi-year community accommodation plan.
Thank you, Ms. Yip. And just on that point, before I go to Mr. Christofferson, I do recall earlier in your testimony you mentioned that you didn't really have the major problem of housing in Atlantic region. Is the cost of the, just the housing market, you referenced Toronto here. We all know about the cost of housing in areas like that. Are those predictably or predominantly the areas where there is a big shortage? I mean, you have so much dollars for budget, I guess. Obviously, providing housing in Toronto is much more expensive than in Truro, Nova Scotia.
And that's one factor that comes into play.
Thank you. Mr. Christofferson and then Ms. Mendez.
Thanks, Chair. If I might, just on that housing and then the two follow-up questions I had. You made the statement that you've got, I wrote it down, but I don't have the exact quote, but to the extent that there was sufficient housing in the aggregate, that there were enough. But I got to tell you, if you look at this report, the fact that some people are having to wait 2 years, the fact that you've got all kinds of facilities elsewhere, but nowhere for the person who's waiting 2 years beyond when they're supposed, there's a mandatory requirement, but they have to go somewhere. So you're keeping them in there, not doing them any benefit, not doing society any benefit, and costing taxpayers more money than they should. You knew ahead of time this was going to happen. I just have a real problem with you saying, oh, we have all kinds of houses, just a little problem over here. Well, that little problem over here is the equivalent to not having enough. Because if there isn't one for the instant case, then what good is all the other numbers? So again, the sugarcoating that sometimes goes on, it's frustrating. It's frustrating when it flies in the face of the report that's right in front of us. On the action plan, Chair, if I might, I'm looking at, it's not paginated, recommendation 4 of your action plan, and it says amend Commissioner's directive. Now, people do these dates different ways. I see 2/19/12/1. I'd like to think that was January the 12th, but I suspect that it's December the 1st.
Yes.
Yes, which?
December the 1st.
Yeah. So amend the Commissioner's directive to add a responsibility to the institutional parole officer. Next one, amend the Commissioner's directive to add a responsibility to the institutional parole officer to confirm. And the next one, amend the Commissioner's directive to add a responsibility to the community parole officer to confirm with the offender, and then on and on. And each one of those is December the 1st, 2019. Help me understand why it takes a year to amend directives.
Very good question, and
I thought so.
And you'll be happy to know that actually the policy has been revised. It's making its way to be promulgated. So we are ahead of December 1st.
All three?
All three.
So why did you put December in the first place? Was your planning that scattered or what?
No, just because sometimes it takes a long time, but this one, it's important. We need to do it. We need to add the responsibility. We've already discussed it with the district directors, so the policy has been amended.
Well, I got to tell you, you're doing it backwards. You got to work with your communications people. Normally, people come in here and promise deadlines that are unreasonable, and then we have to suss out what's real. And in this case, you did it the opposite and caused yourself a headache you didn't need to. And my last question, Chair, is I'm looking at recommendation 1, which again speaks to the housing. And I've read this. I won't say that I fully understand every detail, but two things stand out. One, the dates are awfully faded. I mean, is it like disappearing ink? Is it meant to go away after a while? I'm just curious as to why it's so faint. Unless you've been talking to the defense ministry, who say to you, watch it, they do follow up on what you do and say. But my question is, I read all of that, and here's the question I had. When do you actually start building or acquiring facilities? I see all kinds of planning. I see lots of smoke, but where's the fire? Where is the facility purchase? I'm sort of missing that piece. And it might be that I am just missing it. I accept that.
Yes, and in some cases, it's not necessarily a facility purchase. It's in certain CBRFs, they're going to be adding beds. So, for example, what I can say is that since between
where will they add the beds? Could you just show me? Because that was the part I was looking for, the straight up part that said there will be more beds as of boom, and I just never saw that. I saw lots of planning, lots of stuff, but I never really saw where the beds actually arrive. That's all.
Okay, so for example, this is just an example. In one of the region, there's a proposed expansion with the John Howard Society. And what they're looking at in the next 6 months is having a number of additional beds online. And this is where I said that in terms of the number of beds, for example, from 2017-18 to November 30th, there's 61 beds that have been added in different places. By the end of this fiscal year, there's going to be another 77 beds added in different regions for a total of 138. And there's already 120 planned beds. And there's also several potential beds that different regions are exploring adding as well. So, and
okay, no, that's fine. I'll accept that here, but just know that we will be following up to make sure that these things are happening, because there's a lot of promises here, and in some cases, promises that have been made before to Parliament that you're going to fix things. So I think we're going to take you at your word right now, But understand, we're going to go back and we're
Yes.
going to make sure that the commitments that you're making to us are kept.
Absolutely.
Very good. Thank you, and thank you, Chair.
Thank you, Mr. Christopherson. And Ms. Kelly, last question goes to Ms. Mendez.
Thank you. Thank you all for being here, and thank you for bringing us to some answers. And I think in that I agree with my colleagues that we don't have the full answers. I actually am very curious about the question of the cards, the identity cards, as Mr. Christopherson brought up. It seems to me that it's one of the most essential parts of our identity is to have those cards as citizens, to know who we are and what rights we have. I also understand that the health cards are suspended, if you wish, once somebody is incarcerated, because it becomes a federal responsibility, if I understand correctly. Again, it's a jurisdiction that belongs then to the federal government. When they are liberated into the community, and it becomes, again, a provincial responsibility, do they also go through the 3-month period of wait that we have as, you know, for example, new immigrants who arrive in a country or interprovincial moves? Do they also have to undergo that? Those,
Jennifer.
So like a lot of things in Canada, it depends on the province. Some provinces will reinstate healthcare immediately upon release if you were in that province prior to being incarcerated.
Okay.
Other provinces, if you're released to a province you weren't residing in before you were released, will do the 3-month coverage, and other provinces won't. So it really does depend province by province. So what we're doing is tracking at a province by province level, what are the barriers to accessing both the health card and then the services, and engaging.
But on that, so if some provinces do give that 3-month, delayed admission period, would the federal government then cover that 3-month period on health services? Would you provide the services while they're waiting for their health or their provincial health cards?
Yes, we do provide limited health services in the community, recognizing that there are gaps in care. And
it's more, actually, what I'm more preoccupied, if I
Yes.
may, is more the mental health services, because I think that's probably the most urgent thing they need once they're released, for those who have issues.
So we spend approximately $16 million a year in the community on health services.
Okay.
So that's above and beyond what provinces are providing. And of that 16 million, 13 million is directly mental health services. So the vast majority is focused on the mental health needs of offenders.
And is this being tracked in a manner that it's easy to access, to
expenditures?
see
Yes.
province by province? And
Yes, we could do it region by region for sure, of the 5 regions. I'm not sure if we could do it province to province. But
okay,
we can
but
check
5
on that.
regions is already quite
Correct.
good. Would it be possible to send it to us?
Yes, absolutely.
I'd appreciate it. That's all for me. Thank you.
Thank you very much, Ms. Mendez. I do have a couple of questions here. As you all know, after every study, we write a report, and so some of these questions come from our analysts, giving them full credit for good questions. But recommendation 677 in the report, Correctional Services Canada should broaden its measures of the successful reintegration of federal offenders as law-abiding citizens after they complete their sentences to better reflect its mandate. In your action plan, however, you've provided a response and the next steps, but have not provided a date of completion. And I'm just wondering if you could please explain why on recommendation 6.77. When you look at the action plan, it talks what you're going to do, but unlike the other recommendations, there is no definite expectation as to the time that we can see that it's completed.
Yes, a good question. That's because we're working with both Public Safety and Statistics Canada. But what we can do is, in speaking with our partners, is see if we could get kind of a timeline for this one.
All right, thank you. The other question, I am pleased with this meeting in that the amount of time, I think all our members will recognize the amount of time that we have taken to talk again about data. And, I counted the times, different times, 1, 2, 3, 4, 5 specific issues around where data wasn't gathered, it wasn't maintained, it wasn't managed, it wasn't available, it didn't include the data on the convictions. Some of those came out in today's meeting, and I'm pleased about that. Just a final question to CSC, more for my own, edification. I don't know if that's the right word, but why between 2014-15 and 2017-18 did the numbers of offenders under community supervision increase by 17%? Was there an increase in the prison population preceding those years, or were more offenders than normal released early? Was it based on a lack of room in some of our institutions, in our penitentiaries, or was it just a goal that we're going to increase community service? What happened there that kind of facilitated that extra 17%?
Thank you for that. I think it's a combination of things. Certainly, there's more offenders being released earlier on day parole, and we've really pushed staff to ensure that offenders have eligibility dates, and as much as possible, they should be enrolled in programs, completed the programs by the time they are eligible, and their case should be prepared so they can see the parole board. So we've really pushed on that. So that's one thing. The other thing is I appeared before this committee before to talk about our new initiative with Indigenous offenders, where we've created Aboriginal intervention centers, and especially for those that are medium security, that are serving shorter sentences, we really want them to get into programs in a timely fashion. Once they successfully completed the program, we reassess them, and we want them to be their cases presented to the parole board. And actually, just by the increase that we're seeing, I think it's 36% for Indigenous offenders, we see that it's working. And the other reason is because we have fewer revocations. So fewer offenders are returning to federal custody, which means that, again, I would say it's a testament to the good work being done by parole officers, program officers, mental health professionals in the community.
I think sometimes, and I chaired public safety and national security committees before, and I think sometimes, we get the feeling that we want to push people through the system as quickly as we can. I can tell you that while they are incarcerated, they have resources available to them that many of them don't follow through with once they're out in the community. And so I think sometimes, is there ever here's my question, is there ever a time when people have not completed some of their programming that are in prison, and yet they are moved into community service? Some of the good programming we have to, addiction or provide people with a career when they get out, or at least the potential for a job when they get out. If those programs aren't completed, are we seeing that they're, regardless of whether the program's completed or not, are moved into community supervision?
It does happen sometimes, yes, that they don't get the chance to complete, for example, their education, may not have time to complete the full program, but that's why we do offer a community maintenance program in the community so that they can follow up once they get back into the community.
So the word there, so they can or they could. Do you have the statistics as to those people where their programming is not completed while they're incarcerated, as to how many of them continue and finish that programming when they're out, or how many just kind of walk away from it?
Yes, we have that data, and we'll be pleased to provide it.
Thank you. And I do want to thank both our Auditor General's Office and our Correction Service Canada for appearing before us here today. In the course of time, as you leave here, you may think that, oh, maybe I missed that one question, or maybe I didn't, maybe I was rudely cut off by the chair when I didn't get an opportunity to finish my answer. And then there's others that have asked to provide that information to our committee. Could I encourage you to do that? That if you have some of the things that you've committed to, if you could forward that into our clerk so that it would be here in time for us to write a report on this meeting. So I thank you very much. I'm going to ask the committee to stick around. We have a few minutes for committee business. It will be in camera, so if we could clear the room fairly quickly, that would be appreciated. But again, thank you for your attendance today. We're suspended.